Hi, so today I'm going to be talking about high risk pregnancies, what they are, how common they are, what are some risk factors, and a little bit about a personal experience and just kind of my opinion. So, what is a high risk pregnancy? There are many different websites you can go to, many different articles you can read, books, pamphlets. But the one that stuck the most out to me was the most clear and exact. It was from a website called nichd.nih.gov. It's about basically the article is what is high risk pregnancy? And it defines high risk pregnancy as a pregnancy that threatens the life and the health of the mother and the fetus. And it requires a specialized care from doctors and trained providers, professionals, whichever you want to call them. And how common is this? Like, how often do women go through this? So think about all the pregnancies in the world. How many times a woman gets pregnant? She could only really get pregnant once in a year, in all reality, if you really think about it. But anyways, so how common is it? It's 6 to 8% of all pregnancies. So that doesn't seem like a lot at all. So why is this such a big deal? Why am I talking about this? Well, high risk pregnancies are seen as a taboo thing. We don't talk about them. We don't talk about what a woman goes through or before, during, after. Before, I'm talking about like when she finds out, before she knows that she has this high risk pregnancy, how she feels. Does she know that she's going into this pregnancy with these problems? Or does she find out after the fact that, hey, yes, you're pregnant, but this is what's going on? Or, are there things that happen in this pregnancy that are lifelong? And those are just some of the things I'm going to touch base on. But some of the risk factors is the one that hits close to home is ectopic. Ectopic pregnancies are considered a high risk. I personally went through one. And I'll talk a little bit more about that later on in the video. But some other risk factors are blood disorders like sickle cell anemia. You could suffer from depression, anxiety, and stress. And all three of those, especially stress, on the body is not good for you in any normal setting. So when you add a pregnancy to that, that can cause so many more problems for you and for your child. You can have high blood pressure that is uncontrolled or left untreated, and it can cause to a placental abruption. You could have HIV and AIDS, and you could transfer that to your child. You could have lupus, which is supposed to make it even harder, just like PCOS, to have a pregnancy. You could be too young to be having a child, or you could be considered too old to be having a child. Or you could have had a miscarriage before, and that makes you high risk. Or you could have had a stillborn, and that makes you high risk now. You could suffer from thyroid disease, obesity. You could have type 1 or type 2 diabetes that leads to you delivering a large baby. Or you could have multiple babies, which twins, triplets, quadruplets, however many babies you want to have. That can be a risk factor too. There could be birth defects where the baby has a tumor on the brain, or the baby could have their intestines growing outside of their body. They could have a heart defect that is caught very early on in pregnancy, or your baby could have something wrong with its arms or its legs. Things like that are what are risk factors that cause you to have a high risk pregnancy. So why is she talking about this? This is probably what you're asking yourself. Why is she so strongly saying like, oh my goodness, she's making these faces? Because this is something I truly believe in. I went through what is now, I didn't know this then, but what is considered a high risk pregnancy. I had an ectopic pregnancy that led to me having a ruptured fallopian tube that was so severe that it could have ended my life. And I just feel that this is something that needs to be talked about. People need to be made aware of what is going on with a woman during her pregnancy. Pregnancy is seen as this beautiful thing in life. It's so beautiful. We're supposed to be so happy that we're pregnant. You see that test and it's positive, no matter which way it tells you it's positive, or you get a call from your doctor after you've had this test to confirm you're pregnant. You find all these different ways to tell your significant other, your family, your friends. You have these gender reveals, baby showers for something to happen. And it's very hard and it's very emotional on the mother, and nobody realizes it. So, risk factors. I keep coming back to this. Why? Why am I so keen on these risk factors? Because these risk factors, they can control so much of your pregnancy, how you feel. My best friend, my niece is beautiful. She had my niece. My niece was diagnosed very early on with spina bifida. It's not seen as a reason to be high risk, but to her, she also was anemic. She had other problems with her pregnancy before that, so she was. I've had friends who've had preeclampsia. I've had friends who have had a healthy baby girl, and at 36 weeks, their baby has no heartbeat, and she still has to deliver that baby. I've had friends who their child was and had their intestines growing outside their body. I have a friend, her daughter is about to be born, and she has a tumor in her subarachnoid membrane. And there's these things, and we don't try to even sympathize, or we try to sympathize, but we don't really. We sit there and we're like, oh, if you need anything, let me know. But no one understands what that mother is going through, how it affects you. How does this affect a woman? So when you have a high-risk pregnancy, no matter what the cause, whether it's lupus, your age, you have HIV or AIDS, you've had previous miscarriages, stillborns, ectopic, you know there's a birth defect, you have a kidney disease, you have a blood disorder, whatever it is, on top of being pregnant, it adds the stress to you. You have more doctor's appointments you have to go to. Your insurance is probably higher and you probably have to pay more bills. There's so many different things. Or you didn't realize you were pregnant until you were 4 months along. And the whole time you've been pregnant, you've been smoking. So now that has led to a birth defect. So now you have to deal with that, what you feel is guilt. And you have to deal with that on top of taking care of your child. Or you drank too much, or you did drugs, whatever it is okay. But for us not to sit there, or for us to sit here and judge someone, oh, she can't get pregnant, oh, she's not going to have babies, I wonder why. Let's ask her 10,000 times at Christmas, when are you going to have a baby? Know that for some women, it is hard. It is harder than what you think. Or they were pregnant 2 weeks before you asked that, and they just lost their baby at 8 weeks, and they hadn't decided to tell anyone. You know, you never know what's going on in that person's life, no matter what. And a high-risk pregnancy makes the emotions on top of being pregnant so much worse. You could have your pregnancy is this beautiful thing, and we take it, and society, family, and looking from the outside in, we don't see what's going on in their lives, and we just I don't even know how to explain it. We manipulate it. We make them think, oh, well, this is how it's supposed to be. Oh, I did this. And that's not. High-risk pregnancy is probably one of the scariest things a woman could ever be told, no matter what. And we should be there for the mother, the father, if they're already children, for their children, help out. Don't just say, oh, call me if you need anything. No, help. genuinely help the mother.